What regularly performed medical procedures or practices do you think people will look back at with disgust in 75 to 100 years? In 100 years, probably cancer treatments, in particular chemo and radiotherapy. They are such a sledgehammer approach, and hopefully we can do much better in less than 100 years. I think that we are still in early stages of psychiatry, and in the future what we do now will be seen as so primitive and ineffective, and we will have much more effective and helpful. IUD insertions. The lack of pain control during gynecological procedures will be seen as barbaric. I think a lot of women's healthcare will be under fire in the future. Things like no proper pain relief for painful procedures like IUD fittings. The weird, archaic views on giving birth naturally, like having an epidural, is some kind of failure. The try it and see what happens approach to hormonal birth control. The terrible failings like the vaginal mesh scandal that happened because no one bothered testing the mesh for that purpose before sewing it into thousands of women. The documented fact that women's pain isn't taken as seriously as men's because women are seen as hysterical. The fact that many medications are only trialed on men. The fact that even common problems like heart attacks are underdiagnosed in women. Women's healthcare has a long way to go before it reaches levels that I consider acceptable, and I hope that in the future it will be looked back on with some horror. Dear God, I hope it's birth control, burn treatments, treatment for diabetes. I have to stab myself daily for the next year with blood thinners and it sucks. My belly has bruises and I still choke up when I've got to do it. I can't imagine being told that I've got to do it for life, and BTW. Food can kill you if you're not paying attention. Hopefully we will have figured out how to treat chronic pain patients without either denying them pain relief outright or treating them like criminals. I have a back bad enough that it is now a disability. Just getting treatment options is a huge ordeal, and even asking for any relief gets folks like us labeled as drug seekers. The whole system is cruel and not necessary. Futile attempts at life-sustaining care, ventilators, feeding tubes, etc. for advanced dementia patients with minimal quality of life. Does dental treatment count? Probably extractions. IUD insertion without pain relief. A lot of healthcare involving female genitalia is really barbaric IMO. The clamps used for pap smears, the little tools for IUD insertion, forcing people to birth on their backs, etc. Hopefully that changes. Doctors telling suffering patients that they look fine, that they are too young to worry, that they just need to lose weight, that they are too sensitive, that they should try to avoid stress, and every other cruel, patronizing, lazy, inept dismissal that is currently standard practice for way too many doctors. There will probably be better drugs for obesity, so they'll see gastric bypass as unnecessarily brutal. Hopefully those with serious chronic pain from real diseases will be treated like human beings again, and will be taken seriously. The way chronic pain patients are dealt with is criminal. To get tested for celiac disease, if you have already quit gluten, you have to start eating it again for 2 months of hell. It was 2 of the worst months of my life, and believe me, that's saying something. I was so tired, in so much pain and misery, and couldn't think straight, couldn't work. And in the end, I have non-celiac gluten sensitivity, which is still autoimmune enough to disable me for weeks, and harm my brain and nerves, cause me accident and injury, but there's no test for it. It's just vibes. Elmo FML. One tiny upside. Gluten doesn't even look like food to me anymore. I've been reverse Pavloved. You'd think you'd be excited for a vacation from your diet to eat donuts and pasta and pizza. Nope. Hopefully we will be shocked that euthanasia was not an available option for terminally ill people. Not letting people with fatal, painful diseases and little to no quality of life die gracefully and on their own terms. Hopefully, circumcision and female genital mutilation. I already find it weird that they cut the tip of people's dicks off, mine included. Cervical and endometrial biopsies. Fucking barbaric.